You know, there are times in our lives, or if it hasn't happened, it will, when you need help and you need it very quickly. And none more important than dental care. We are with Dr. Charles Vogel, and he is with Dental ER. Dr. Vogel, thank you very much for having us by.
Hey.
Where did you come up with an idea for this kind of clinic, this kind of service?
Well, the long version and the short version are different. The long version's on the internet. The short version is that I practiced dentistry in a general dental practice for a number of years here. And after doing that, I realized that there was a number of people who just couldn't get regular care, and they'd put things off to the last minute. And we really needed to take care for those people, not send them to the emergency room, not just give them medicine, but actually relieve their pain. So our goal here is to relieve dental pain within an hour after they get in here, and usually that involves the removal of a tooth.
Well, you know, you say that, you know, you deal with the pain, different things like that. Dentists around the world do that. What makes you different? What sets this clinic apart?
Number one, it's the only walk-in clinic that you need no appointment for. So we're available from 9 to 2, Monday through Friday. And you just walk in, and most people will be seen and out of here within an hour. We do ask that people get here before 1 o'clock in order to be seen and treated that same day. Now, we may be able to get medicine for them, tide them over till the next day, but in order to get a procedure done, we need about an hour.
Talk to me a little bit about the procedures, the services that you have here at Dental ER.
Well, that's a good question, because it's much easier to tell you about the services we have, because the services we don't have are huge. We don't do any general dentistry, we don't do any cleanings, we don't do fillings, we don't do the routine kind of things that people would expect from a dental office. What we do is the removal of wisdom teeth and other infected teeth. We do temporary fillings on a few occasions, and we do toothache treatments for people who choose to have a root canal. But the majority of our work usually involves that the tooth is in such bad shape, there really isn't much left by the time we see it.
Yeah, but you know, from what you said right at the beginning, this sounds like the folks who are coming in here, they're in pain. They need help right now.
We really kind of triage on the phone, and that's one of the first questions we ask them when they call in. They're of course concerned about money, they're concerned about a lot of things, but what we ask them is, are you in pain? Do you need to be seen today? And if so, you've called the right place.
Well, what's kind of the procedure once someone comes into the ER?
Once someone comes into the ER, we're going to use our fast check-in, and that allows them to immediately check in. Then we take a digital x-ray of the mouth and discuss their problem, what's going on in there, what may be causing the pain, what could be causing some pain in the future, and we give them some choices about what they want to do.
All right, people want more information. They need to know about your services. They need your help. How do they get that info?
Well, the web is probably the best way. We cover a lot of stuff on the web. They can always call our number, 851-8111. They can call that, and we have two lovely people that answer the phone. One over here is our big clown, and she's always available to answer questions and do the things that you need to have done.
All right, Dr. Vogel, thank you very much for having us by. So when you find you need that help right now, Dental ER.